we will discuss about anemia classification, symptoms, cause, proper nutrients and treatments. Subscribe our YouTube channel Medical Help 365 days to see medical related useful videos and press bell icon to get free updates. It is a health condition in which the number of red blood cell, RBC, count or hemoglobin, HP, is low than normal level. Anemia is caused by either for a decrease in production of red blood cells or hemoglobin, or for the destruction of red blood cells or loss, usually due to excessive blood loss. Know about red blood cell, RBC, and hemoglobin, HP. The very common another name of RBC is erythrocytes. One of the most important cellular parts of blood cells is red blood cells. Red blood cell, RBC, is the important blood cells that carry oxygen from the lungs to the other parts of the body. The cytoplasm of red cells is rich in hemoglobin, and it is the hemoglobin which permits them to transport oxygen. Hemoglobin molecule is the functional unit of the red blood cells and is a complex protein structure that is inside the red blood cells. What is the normal range? The normal range in men is approximately 4.7 to 6.1 million cells per microliter. The normal range in women ranges from 4.2 to 5.4 million cells per microliter. The normal range for hemoglobin may differ between the sexes and is approximately 13 to 18 grams per deciliter for men and 12 to 16 grams per deciliter for women. Classification of anemia or anemia according to the size of the red blood cells. Microcytic anemia: if the red blood cells are smaller than normal, this is called microcytic anemia. Microcytic anemias are caused by conditions that prevent your body from producing enough hemoglobin. The major causes of this type are iron deficiency, low-level iron, anemia and thalassemia, inherited disorders of hemoglobin, and sideroblastic anemia. Normocytic anemia, MCV 80 to 100, if the red blood cell's size is normal in size, but low in number, this is called normocytic anemia, such as anemia that accompanies chronic disease or anemia related to kidney disease. Macrocytic anemia, MCV greater than 100, if red blood cells are larger than normal, then it is called macrocytic anemia. Macrocytic anemia can be due to a deficiency of either vitamin B12, folic acid, or both. Major causes of this type are pernicious anemia and anemia related to alcoholism and hypothyroidism. If you have a low RBC count, symptoms may include fatigue, dizziness, weakness, particularly when you change positions quickly, shortness of breath, increased heart rate, headaches, pale skin or yellow skin, chest pain, cold hands and feet. What are the common cause of anemia? Iron deficiency anemia is the most common type of anemia. It happens when you do not have enough iron in the body. Iron deficiency is usually due to blood loss or inadequate iron intake, or may occasionally be due to poor absorption of iron. Iron is a very important component of the hemoglobin molecule, erythropoietin. A molecule secreted by the kidneys promotes the formation of red blood cells in the bone marrow. Iron deficiency anemia can also occur when there are stomach ulcers or other sources of slow, chronic bleeding, colon cancer, uterine cancer, intestinal polyps, hemorrhoids, etc. Anemia from active and excess bleeding. Anemia related to pregnancy, water weight and fluid gain during pregnancy dilute the blood, which may be reflected as anemia since the relative concentration of red blood cells is lower. Anemia of chronic disease: any long-standing and ongoing medical condition such as a chronic infection or cancer may cause this type of anemia. Anemia related to poor nutrition. Sickle cell anemia: this is typically hereditary and is more common in those of African, Middle Eastern, and Mediterranean ancestry. Abnormal hemoglobin molecules may cause problems in the integrity of the red blood cell structure and they may become crescent-shaped sickle cells. Pernicious anemia: it may be a problem in the stomach or the intestines leading to poor absorption of vitamin B12. Hemolytic anemia is a type of anemia in which causes for the red blood cells destruction known as hemolysis. Nutrients that can increase red blood cell counts. Eating foods rich in these 5 nutrients may help you improve your red blood cell levels. Iron. Iron-rich foods include red meat, such as beef, organ meat, such as kidney and liver, egg yolks, dark, leafy, green vegetables, such as spinach and kale, dried fruits, such as prunes and raisins, beans, etc. 2. Folic acid. Foods high in vitamin B9, folic acid, include enriched bread and cereals, dark, leafy, green vegetables, such as spinach and kale, lentils, beans, peas and nuts, etc. 3. Vitamin B12. Foods high in vitamin B12 include red meat, such as beef, fish and eggs, milk products and cheese, shellfish, etc. 4. Copper. Copper intake doesn't directly result in RBC production, but it can help your RBCs access the iron they need to replicate. Foods high in copper include poultry, shellfish, liver, beans, nuts, etc. 5. Vitamin A. Foods rich in vitamin A include dark, leafy green vegetables, such as spinach and kale, sweet potatoes, carrots, red peppers, fruits, such as watermelon, grapefruit, etc. Treatment of anemia. The doctor may not treat your anemia until the underlying cause has been established. The treatment plan will be based on the underlying causes of anemia. If the patient is severe anemic, then a blood transfusion may be needed.
Visit our website www.medihelp365.com. Find doctors, hospital, medical service provider information. Read article and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical videos.